Kathleen was gone. Dr. Abdulwaheed, am I
got it.
right?
You're very right.
I'm so pleased to have another show with you. You came in about a month ago and we talked about Masshealth.
Yes.
Just touch on that briefly. Where does it stand?
Currently, they're still debating on whether they can even sustain the Masshealth Dental budget. But as far as I know, things are not going very well for us. And there's a very, very good chance that they may be eliminating Masshealth dental coverage for the most needy population in our state. I think the bill is right now with the Senate, the state Senate, and they're going to make some decisions very soon. So it's very important for our communities, those who are dependent on Masshealth and those who are not even dependent on Masshealth, to make sure that they give their representatives and their state senators a call and try to educate them as to how important it is for us to maintain and sustain dental coverage for the most marginalized in our communities.
I think it's wonderful you care. And is it because of the economy, because of the times you think they're addressing this?
The economy is certainly a factor. I mean, many states are having budget issues, but the economy goes in cycles, as we're all aware of. People's health can't coincide with the economic cycle. If we are to decide who gets dental care and who gets medical care based on the economy, then we're really not doing a just service to society. We need to keep medical care, dental care consistent. We can always fix the economy. We can always build another road. We can always build another factory. We can always expand our budget to cover things that are not necessary. But there's nothing more important than healthcare. Very often we can't rebuild human anatomy once it's reached a point where pathology has taken over. So it's important that we maintain preventative care. We provide our citizens with treatment when they need the treatment. So it's important that we sustain these health-related budgets and not let the economy affect the budget.
Good. So what they can do is call. I've called many times on different things.
Sure.
So call. Pick up your phone, find who your state rep is or your senator, and call. Do you know?
I was very pleased after our last show that we got a huge response.
Good.
A lot of your audience have been wonderful. They've called me, and a lot of them have called their state representatives and their state senators to inform them what they've learned from this show and that what they are aware of from their own personal experience. We really need to keep up with this. We really need to keep up with the calls. On the 5th, the Mass Dental Society will be going up to Beacon Hill to educate our representatives and our senators.
And you'll be there?
And I'll be I'm certainly going to be there. I'm going to go present a large volume of petitions that we were able to collect both from the internet and both from our office to let our representatives understand that our citizens care about this issue, and it's important that they represent us and they try to protect dental care from being eliminated.
Excellent. Now, the reason you care so much is you're also a dentist.
Yes.
And people may not know where you are. You're at Lux Dental,
sure,
next to Tom O'Brien.
Yes.
That's a pretty good guess. Most people know where that is.
Pretty straightforward, yes.
Tell us a little bit about your background, how you came to be a dentist.
Well, I started off being a chemical engineer. Went to Tufts, and then I moved on and I studied medical imaging as a graduate physics student. And then after that, I went on to dentistry because I felt that the science background I had integrated with the medical sciences very well. And the dental profession is a profession where I can utilize all the skills and all the up-to-date technology that I've learned as an engineer. And I found it to be true. I am currently being able to apply a lot of the great sciences that I was taught in university and engineering into the medical sciences. So dentistry's become a great profession for me.
And you have how many? Tell us about your office.
Our office, there's 5 operatories. We have 5 full-time general dentists that serve us. We have 3 pediatric dentists that serve us, children specialists. 2 periodontists, gum specialists, a single root canal specialist, and we've got a great, fascinating gentleman, Dr. Ryan, who does all our oral surgery for us. It's a great office, and we're able to sustain and maintain a large population's dental health needs, from the children to the geriatric population. We're able to cover a whole spectrum of people that really need dental care.
And to show the viewers how, to tell them, with this water scare, you didn't have to worry.
Well,
I mean, you did worry, but
we certainly were. As soon as we heard about the water situation that we're facing in Quincy and around the state, we were very much concerned in terms of the water source, and we've replaced all our water supply with distilled water. So this way we can reduce the probability of any infections, and so far we're planning on maintaining the distilled water flow for at least a couple of days until we're certain that the water supply has returned to normal.
Why should people take care of their teeth? Why not let them rot?
People should take care of their teeth because it's connected to the body. Every single tooth in actuality is a separate organ. It's got its own blood supply, its own lymph supply, its own nervous supply. So if you value your kidney, your liver, your lung, you should value your teeth as well. And in addition to teeth, we're really dealing with overall health. We're dealing with your bone, we're dealing with the gums, we're dealing with a lot of the supporting structures in your oral cavity. And as we've mentioned last time in our last show, there are integral relationships between oral health and overall health.
Can you spot if I have something? Can you tell if I have something?
Well, a lot of diseases shows initial signs and symptoms in the oral cavity. For example, one of the major orally related disease that dentists have been paying particular attention to right now is oral cancer. 35,000 Americans are diagnosed with oral cancer every year, and 1 American die every hour, every day, of oropharyngeal cancer.
Is it from smoking?
I would definitely love to talk to you about this because it's a very important topic. Yes. The research has indicated that smoking, any form of tobacco, even chewing tobacco, cigars, in addition to alcohol use as a combination, increases your risk of oral cancer. In fact, if you drink and you smoke, it increases the risk of oral cancer by 15 times.
Is that so?
Oral cancer is a particular concern because if it is diagnosed early and it is treated early, it gives us a very, very good prognosis. But the problem with oral cancer is very often it is discovered very, very late when it's already pretty much metastasized, when it's spread. And the problem with oral cancer is once it's spread to a secondary site, it creates it increases the difficulty in treating this kind of cancer. So if you were to visit your dentist routinely, they would do a head and neck exam. They will palpate along your neck. They'll feel your lymph nodes. They'll look into your mouth. They'll look at the side of your tongue. They'll look at the floor of your mouth. They'll look at the side of your cheeks. And if they do notice something that is abnormal, and if they do catch it early, there is a very, very good chance that this disease could be put under control and could be treated. And in the past, we haven't really focused on this life-threatening pathology for the longest time. And that's why it's very important that we bring up these issues and let our community understand that it's important for them to go and get their routine checkups. And it's very important for them to know the effects of alcohol and tobacco. These substances in excess could definitely cause a lot of life-threatening issues.
When you